Dr. Anish Wadhwa. Good morning.
Good morning. Hi, thanks for having me.
Yeah, glad to have you.
Appropriate to have you here on the first day of snow.
Luckily, we're good drivers in Michigan,
Yeah,
right? I think.
We're fantastic.
There have been some fender benders on the highway today.
Well,
already.
yeah, I mean, this is one of those, this is the weather where I'm glad I don't drive around Metro Detroit for work.
Oh, stop, start.
Yep.
Well, this is a good time to talk about, pulmonary health and the winter. So there's some things winter either causes or there are some increases in illnesses because of winter.
I think we were just talking about, change in weather and change in seasons, but there's always some things that come around this time of the year. People are more bunched, they're indoors. Virus season is now. I think a lot of what it ends up being is people just exercise more common sense, hopefully, and then they can stay clear of things that are out there.
I think the hand washing, the social distancing, I think we're all still mindful of that.
Yeah, I
and
think so.
It works, doesn't it?
It does. I mean, your grandkids are going to bring whatever they got, and you can't avoid that. And so, where do you take some precautions? If maybe don't bring them around grandma or grandpa when they're sick. Regular stuff.
Let's talk about some winter immunizations for respiratory diseases.
Yeah, I think one of the things to consider is that for folks, there's a lot of noise recently about many things, but there are some common recommendations from the CDC, and as with anything, this is a dyad between you and your doctor about what's the right thing for you, right? And not everybody needs the same things. The wintertime, COVID vaccination is certainly indicated, flu vaccination, and especially RSV. If you have not heard about this is a good thing to go talk about with your doctor. There are certain populations, we always used to think about this as the youngest and the oldest. A lot of times it's a question if there are tools available to use, and RSV vaccines are now available, whereas they used to not be. Is this right for you? And so where you can take precautions. I think that's the big message for all of this is, where is the place that you can cut your risk down, and that's under the advisement of your doctor.
Let's talk, benefits of having some of these vaccines.
Yeah, I think it's less about just the abstract of what burden is. It's that there's illness, missed time from work. What is the long-term consequence of getting sick? And there are common vaccines that we know have been available for some time, and there's good data about this. Now, what's the question about facts or not? This is where you go back to your doctor and say, I know what the data is, what's right for me. But vaccination against common things like flu and pneumonia, especially this time of year, chronically for people who have conditions like hepatitis and others, there is some value in saying, hey, what are the things that I need to consider? In the long run, it has less to do about whatever the financial impact is per se, and is more about how does it impact your health in the season. And so, where is that opportunity to reduce risk? So, there's a lot of stuff that government will put out or organizations will put out in terms of cost. There's a big impact on people going to work, for example, and employers are interested in people being healthy. So part of this is to say what's right for my worker, and part of it is preventive medicine. That's where vaccines come in. So there's significant financial impact.
Wow.
It's also, because all of these viruses are spread person to person, you're protecting not just yourself, but everyone you come in contact with.
And there is some concept about how you and this, people have maybe heard the term herd immunity. We'll leave that for the specific discussion, in terms of what a scientist may talk about, or the benefit for a larger population. If we're thinking just about you and your family, there is some idea about thinking, well, maybe all of us should be protected so that grandma or grandpa don't have risk. And part of the problem comes is that as time has gone on, there's been less interest and appetite in getting vaccinations. And so how do we counteract that? Flu vaccine rates have gone down. And there's been a lot of discussion about, well, what is that in efficacy? It depends on the person why a vaccine may or may not be appropriate. Generally, we think for everybody, flu and pneumonia vaccination in the season is right. I just mentioned that RSV depends on who you are. But we have to figure out how do we counteract this, because as time has gone on, less people are getting things that we know are beneficial.
And I think, in some parts of the world, like where there's war, polio rates are increasing because they're busy fighting a war or trying to stay alive.
Yeah, no one's going to the doctor, I'll tell you that.
Yeah, and this gets back to that same point that there are things that we already know that are true, right? Vaccinations against polio. and measles and things like this. And you can see some of the stories coming into the news now where it's not an outbreak, but there's a case or two, and these are not things that we've heard about for decades. And I can tell you, seeing patients, it's not as common now. Some of the folks in our practice used to be patients who had suffered from polio, and they have fixed lifetime deficits. So we're trying to avoid big consequence of things with small interventions that don't have a lot of cost.
So when we first were able to get the COVID vaccine, we knocked each other over to get in line.
Didn't care what was in it.
Yeah.
Right? You remember that?
Yeah, it's like, and people were calling us, hey, can you get me in?
Yeah.
Right.
There's not that demand now.
And I think that's a lot of the noise I was talking about,
Sure.
and this has to then be considered person to person. So this is where you go to your doctor and say, what's right for me? And there's a lot of question about what side effects are and the consequences of vaccines, but this graphic, a lot of this stuff I pulled from online from the CDC or some other ID websites, as time has gone on, people are less likely to say, I want this thing. Why is that? Is it because the science isn't there? Is it because there's some noise that I'm hearing that, well, maybe this isn't a good thing? And I think this is where you say, hey, for you, go to your doctor and say, what is the right thing for me?
Sure.
By and large, we know that there's benefit to these things, reducing the intensity of your condition if you get sick. And in the beginning, we didn't have that. And we thought how many lives might have been impacted by having a vaccine available. It takes time to develop these things. It takes time to refine them. But again, there has certainly been a regression in terms of how many people are interested in getting these things or even talking about them, I'll tell you that.
I think a lot of it too is, society is just lazy. I mean, frankly, in general.
Yeah, well, it takes time. You have to carve some time to go to the doctor or the drugstore and or get an appointment, and people are busy.
We use this concept about fatigue, like you're tired of hearing about things, right? And so, patients who come to my clinic, I'll tell them, look, we should consider this. They said, Doc, you said that last time. I said, I'm going to tell you again. My job is to tell you these things. Now, if you use the information, I'm trying to convince you. It's a sales pitch.
Right.
But this is a community effort. So you get good data, you talk to your primary doctor, you talk with your family. And this is beyond flu and pneumonia vaccines, which we know are beneficial. There's good data. There's a couple of options on the market here about RSV, which is a virus.
Some data
so this year. And so there's a couple of different things to consider. And this is widely available. There is some longevity to the effect of the vaccine that, you get it. Again, this has to be considered. Who is that person? So, we typically used to think babies 1 year or younger or older folks above 70. But, there are people in between whose risk is high, and it has to be considered case by case. And so these are new things, yes. And so I don't know that we should be scared of new things. We should say, hey, how does this new thing fit for me or not?
Sure.
Yeah, well, like you said, when the first COVID vaccines came out, we didn't care what was in them. Let's just get it to us.
It's interesting how the mindset, right? And our country almost has a mindset together. Kind of shifts together.
And things shift, and it's like a big herd pack mentality. And again, this is the same thing talking about stuff that we always knew or stuff that used to be there. Now there's something to address it. So we always knew flu and pneumonia vaccine was helpful. How do we counteract that people want the flu and pneumonia vaccines less than you used to? Now, RSV is not a new thing, and shingles is not a new thing, and there's a vaccine for shingles, and we've seen, as the data has been reviewed over time, the benefit of shingles vaccines too. So what is it about things that we knew were always there? This is a new tool to reduce the risk for those who, immune compromised patients, et cetera. Why not avail ourselves of those tools if we can, if it's a right thing for that patient?
And they work.
They work and they last. And I think the graphic about the shingles vaccine says the same thing, that over time, these are things that help reduce disease burden. And so people can have significant long-term consequence. Yes, it might be just a cough or a cold, but in the wrong person, RSV can lead to hospitalization and then morbidity. And shingles can lead to the same thing. And this is something that not everybody needs. This is where that direct communication and shared decision-making with your doctor is really important.
Also, another thing that you're concerned about within your practice is COPD.
Yeah.
And for a lot of people, cold weather makes it even harder for breathing.
There are a lot of things that we can avoid, and we can't avoid the weather. We can't avoid change in season. People may have overlapping things that trigger their COPD with humidity or pollens and things like this. There are some recommendations for what is considered. So this graphic talks about what is evidence A, evidence B. there's really good data for many things, and most things in medicine, we may not have 100% data, but there is very good data over the course of decades which says these interventions help for COPD. Medications, not smoking, exercise, and vaccines are on that list. And so if you think you have COPD, if you think you have asthma, if it's not been diagnosed, maybe you go talk to your doctor about diagnosing these things and saying, hey, what are the right things for me?
Trust the science, trust the data, trust your doctor, and thank you, Dr. Wadhwa.
Thanks for having me.
Yeah.
Dr. Anish Wadhwa, Pulmonary Clinics of Southeast Michigan on The Morning Show. And we continue after this.